Good morning, everyone. My name is Marla McGinnis. I will be your moderator this morning for today's announcement. Before we begin, I'd like to introduce the Honourable Tim Houston, Premier of Nova Scotia, Karen Oldfield, CEO of Nova Scotia Health, Minister Michelle Thompson, she's Minister of Health and Wellness, and the Honourable Colton LeBlanc, Minister responsible for healthcare redevelopment projects. Go ahead, Premier.
Thank you, Marla. Good morning, everyone. Welcome, and thank you for coming today. This is a good day. This is a day that I know many Nova Scotians have been waiting for. Today, we're talking about building more and building it faster. We're building better access to healthcare. And when I say building, I mean it, literally. We are building the new hospital and urgent care capacity that patients and families across this province need. We're giving healthcare professionals the safe, comfortable work environments that they deserve, and we're building all of this faster than ever before. Nova Scotians deserve better than to be told to wait a decade or more. That's not good enough for them, and it's not good enough for me. We're not going to wait. We're going to cut that timeline almost in half, with major projects completed within 5 years. Today is not just about speed. It is also about certainty. It's about getting things done. I'm not here to commission a report or report on a commission. I'm here to say that we are ready to put shovels in the ground, and we're going to do that in early 2023. Getting here wasn't easy, but it's the right choice. It's the only choice. The original redevelopment plan was first announced 7 years ago. It was well-intentioned, and good people have worked very hard to see it through, but the good intentions and the good people ran aground on a process built on outdated assumptions. Consider the old plan for just a moment. It would have been a 2 million square foot complex that included no increase in beds, no increase in ORs, no plan to expand or modernize the emergency department, no plan for transition beds, and no capacity to respond to a population that is both aging and growing. In fact, the old plan actually prepared for a decline in the population. That's not Nova Scotia's trajectory. The previous approach was also far too slow. It was announced 7 years ago and was still over 10 years away. On that timeline, there were people who weren't even born when the project was first announced that would have been old enough to work there by the time it was completed. And for the healthcare professionals, patients, staff working there right now, well, we know that that's not nearly good enough. And I want to talk to these healthcare professionals right now, the people working in these facilities. I'm not going to make excuses for what you have had to put up with. We know that your current working conditions are not acceptable for the valuable work you do. You deserve modern facilities that enable you to provide the best care for your patients. It's important for the work you're doing. It's also important for your own mental health and your own well-being. And if we are serious about recruiting more people to join you, well, we have got to give them a workplace that they want to work in. So despite these challenges, I want to thank you for all that you do and assure you that every day that this takes is a day too long. We are going to get you into better work conditions. We're going to do it faster. There's no question that this project will be expensive. But this is about getting it right and saving time. The previous government's good enough is just not good enough for me, and is not good enough for our healthcare professionals. So we went back to the drawing board. We knew the clock was ticking. We worked in good faith with the proponent to understand what was on the table. We invited everyone involved to step back and look at this project with fresh eyes. We challenged the team that has worked so hard to date to dig deep again with the full support of a new government to look to the future and get this right. And the team did it. They took what was working and kept it. They took what wasn't working and fixed it. And they took what couldn't be fixed and replaced it with something better. And they did all that with a complete sense of urgency. And they produced a plan that will save us time. And I'm so proud of them. And I want to personally thank Deputy Janine Lagasse John O'Connor, Dave Benoit, amongst so many other people. Thank you to Dr. Christine Short. Thank you to Dr. Alex Mitchell. They're here in the room with us today. And I also want to thank Minister Thompson, Minister LeBlanc and their staff, as well as, of course, Karen Oldfield and the whole team at the Nova Scotia Health Authority. These people are all solutionists. This is the highest compliment that I can give, and today is the outcome. This is the future of healthcare here in Halifax and across Nova Scotia in three promises: more access, better care, delivered quicker. So in concrete terms, this means over 400 new beds and 4 more operating rooms quicker. A new patient tower, a larger, more functional emergency department, a new cancer care center, all on the Halifax Infirmary site, quicker. A major expansion at the Dartmouth General, including a new emergency department, quicker. New inpatient services at the Sackville-Cobequid Outpatient Center, quicker. 2 new standalone transition to community centers in HRM, quicker. A new mental health and addictions campus, and a new heart health center, all quicker. The previous project kept hitting rewind. Today, we're telling you we're hitting fast forward. And we are well past the starting point on this. The leases have already been signed for the land for the offsite builds across HRM. Considerable work has already been done on the design of the new patient tower. The work will proceed without delay, and shovels will be in the ground much, much sooner than would have been possible under the old plan. And there are other ways we're freeing up capacity as well. For instance, just last week, we announced a new contract to have up to 6,000 low-risk eye surgeries performed off-site. This will free up operating time to tackle wait times for complex eye surgeries at the VG. All of these things add up. This is how we will lower wait times. This is how we will improve patient care on and off the peninsula of Halifax. More hospital beds and ORs will help address long wait lists for surgeries. And more transitional care beds, along with continuing to build more long-term care beds across the province, will ensure that our seniors receive the care that they deserve. This is about providing Nova Scotians with the right level of care when they need it, and whenever possible, to do it closer to their home. We will always, always, always put the needs of our patients top of mind. They've waited long enough, and I want to assure all Nova Scotians that I will not rest until healthcare is fixed. The work is not done, but today, we're closer. More, faster. That's the promise. That's the plan. And I personally will not rest until the job is done. Thank you, and I'm happy to turn the mic over to Karen to give you some more details.
Thank you, Premier. It is a great day. And on behalf of the physicians and staff at Nova Scotia Health Authority, particularly those in the Central Zone, I'm sure it's a very exciting and a day of big relief as well. More faster is a message that I hope resonates very well with our staff. And Premier, if I may, one of the elements of the plan that you just referred to talks about transition to community. This is a new thing in Nova Scotia. Not completely new, but a little new. And we do have Dr. Christine Short, who is a physical and a rehabilitative medicine specialist. And I would like to, if I may, ask Dr. Short if she would be good enough to explain what transition to care beds means for Nova Scotians. And she is right here in the front row, so if I could ask her to do that, I'd really appreciate it. Sorry, it's not as if we haven't spoken many, many times, Dr. Short, so my apologies.
That's okay. I get Dr. Little and Dr. Small, too. So,
But not your brain.
So thanks for the opportunity to speak to this point. And, this is really about the more faster and the Action for Health plan to do purpose building and building to meet patients' needs where they are so patients can get the right care at the right time in the right place. And right now, one of the hats I also wear is that of the department head for medicine in the Central Zone. And every single day we deal with the pressures on capacity in the acute care site. We regularly are 100% and 100% plus capacity at the QE2 in Dartmouth General and actually right across the province. And one of the really important factors that contributes to that, which creates that domino effect of backing up the emergency department and the ambulances and access to care, is that we have a lot of patients in hospital that are finished their acute medical or surgical care needs, but they're not quite ready to go home. So they still need supports. They need supports in a environment where they can heal, get stronger, work with the healthcare professionals who can help them deliver the solutions to get them back into their communities. So whether that's transitioning back home or to a long-term care or other facility. And so that's exactly what transition to community facility will be built and designed around. So it's not trying to provide care in acute care bed for somebody who needs care in a different setting. It provides the purpose setting to get them home better and faster.
Great. Thank you.
Okay, we'll now take questions from the room.
Premier, I know that, with a project like this, there are things you can and can't say publicly throughout the process, but you made mention when you first came in that you were going to pause this thing and review it, and then things continued as planned, and as recently as this spring, Minister LeBlanc said the original design is what you're going ahead with. So at what point did your government make the decision that the original design was not going to work and you had to do something different?
As soon as we know it wasn't going to work. I mean, look, thank goodness that we hit pause and did this review. Thank goodness that we gave the healthcare professionals who have to work in these environments the space and time to speak up on what's really necessary. So, look, every Nova Scotian knows we need healthcare infrastructure investments for sure. You can see that every single day. So the initiative of the prior government was well-intentioned for sure, but the world changed in the 7 years, and we just don't have time anymore to wait. So look, there was an active procurement that proceeded. We listened to the healthcare professionals, and today we've landed on something that Nova Scotians can be proud of. Because if we wouldn't have hit pause and we wouldn't have went through this process, 10 years from now, we've optimistically, maybe 10 years from now, we would have a facility that's obsolete today, let alone what it would look like in 10 years. This is absolutely necessary. So we've fixed all that, and this is a good day for Nova Scotians. And I want to make one point, which I think Nova Scotians really need to know. That facility that we could have had in optimistically 10 years did not speak to anything around our emergency rooms. That was going to be looked at after the fact. They're going to start looking at that after the fact. So look, I'm so thankful to the team of healthcare professionals who have been through a lot. This is an incredibly stressful time to be a healthcare professional, and they've been through a lot of changes and stops and starts and everything. But my message to them today is we're going to get this done, and we're going to move fast, and we're going to get them the working conditions and what they need, the infrastructure they need to provide the best possible care to Nova Scotians. That's what we all want. This plan does it.
But when did you know you were going to have to use a new plan? Because Ms. Oldfield even said recently that probably the original plan wasn't going to be enough, that there may need to be new buildings, and we see that today. So at what point did your government make the decision to go ahead with this?
We're here today. We're here today announcing it. There was look. This is a big project. It took time to look through it. So we looked through it, and we'll make sure we got to the right place. Today, we're at the right place. Along the process of since I've been Premier, there's lots of moving parts, lots of new information every single day. We take the best information we can get, and today we're announcing something that Nova Scotians can be proud of. It will meet their needs today and when it's built, and it will meet their needs into the future. That's our goal, and I'm really proud of the team that kind of They put everything to the side and said, let's focus on getting this right. And they've got it right. And I have complete faith in the project that they put forward, and every Nova Scotian should.
Talk about
A lot. There's no question it's going to cost a lot. But this is not an exercise about, look, I think if Nova Scotians have seen one thing from our government, we're not trying to save money on health care. We're trying to get it right. We're not scrimping. We're not cutting corners. We will get it right. We will invest in healthcare. This is not about, what this is about today, what we're talking about today, is saving time. We can't wait 10 years. We have to get things done quickly. This is not a focus on saving money. This is not about trying to cut corners off any budget. I don't want to give anyone any kind of illusions on that. This is about making the necessary investments. We'll spend what it takes, because we will get this right. And we'll do it quicker, because that's what matters.
Have you seen an estimate of the cost?
Well, everyone has bantied around numbers. This whole infrastructure. When you take all the moving parts, it's in the billions for sure. This is a very, very significant investment. It's a generational investment. That's what's been talked about for 7 years, and it is a generational investment. But this is about getting the facilities that we need in this province to meet the needs of Nova Scotians. And whatever it costs, it'll cost. We're going to get done, though.
Billions more than the original estimate?
No, I didn't say that. Look, we're going to save time for sure. There's different waves to this project. We'll layer on different waves as we kind of put stuff out to tender. Market conditions will change. Labor market conditions will change. We'll see that. Hopefully, we're getting to a period of stability in price changes. But we'll see. But whatever it costs, we're gonna pay it. Because that's what Nova Scotians asked us to do.
Until we see, though, the first question I'm going to get from the editor, how much is this going to cost?
If that's the first question somebody asks, they're missing the point. Because the question should be asked is, how soon can we get healthcare fixed in this province? That's the first question that should be asked. That's the one I asked. The cost is we're going to have to pay it for sure. Now, I'm an accountant, I'm concerned, for sure. But the first question anyone should have asked, and I would encourage your editor to reach out if he wants that.
The two, with respect, Prem, you can't divorce the two because you've got other areas that you need to put money into.
Of course,
right?
We'll manage the budget of the province for sure. We'll make sure that Nova Scotia delivers the services that Nova Scotians have come to have a right to expect. We'll deliver services to Nova Scotians. We're very focused on health. It's half of our budget. If we can't get the infrastructure right and we can't get it right, we're doing a disservice to Nova Scotians. My first question to the team is this what we need? And my second question is, how fast can we get it? Because Nova Scotians deserve it.
Premier, those are the questions that you've already answered in your presentation. The one that we haven't got yet is a ballpark of the cost. So just go back to my question before. Have you seen an estimate?
We don't have a full estimate of. We know a ballpark of what was on the table was going to cost, but there's going to be waves. We're going to put different parts out to tender at different points in time. The market conditions will change for sure. But I can't stress it enough. Our focus is on getting this done faster. Our focus is on getting more, and that's the focus of Nova Scotians.
You talked about we don't know what it's going to cost at this point in time.
Yeah, because there's different waves. We're going to put different things out at different tenders at different times and stuff. Minister LeBlanc can maybe speak to that a little more. He's a little closer, but honestly, guys, I can't stress it enough. If somebody's only concern is what does this cost, then they haven't talked to a healthcare professional, because we have to get this right. Well, it can be your main concern.
But I think
my
the
main
question
concern
comes
is
up,
delivering
sir.
health care to Nova Scotia.
I think the question comes up, sir, because we don't want to see a situation where endless amounts of money are pouring into. We all know about the situation with Olympic Stadium in Montreal, and taxpayers are still, only just wrap that up. Are we going to be in that kind of a situation?
Of course not. There's to be different waves. There'll be different tenders. We're gonna be prudent fiscal managers. But my stress to you is, go and ask 10 Nova Scotians if their primary concern around fixing the healthcare system in this province is how much it costs. I think they'll tell you they want it fixed.
You talked about leases already being signed. What leases and where?
But maybe Mr. LeBlanc, or do you want to speak to that? Well, I guess.
You go, then I'll go.
Yeah, can you, specific to what, Jean?
Well, the Premier talked about leases being signed for the new builds.
So there's work underway for the adjacent to the site of the COC, in Bears Lake, looking at building a new transition to community facility, adding beds. Again, today's announcement is about beds, more beds. As it was stated in the technical brief, the answer to many questions when we're talking about healthcare, whether it's access, whether it's flow in the healthcare system, is beds. Why are paramedics backed up in emergency rooms? Beds, lack of beds. Folks are occupying beds in emergency rooms while they're waiting for acute care bed. That's why delivering on transition to community facilities is going to be very important as we move forward delivering on healthcare in this province.
Leases signed with, Minister?
Pardon?
Who are the leases signed with?
I don't have those details in front of me right now.
Your department provide those details?
Yeah, we'll get those details. Sure.
Minister, specific to these centers, what's the expectation for what that will do to the system when they're complete and they can be used?
So it's part of a broader transformation. So certainly having a transition to community facility as an example will make a huge difference in terms of access and flow, and also making sure that seniors and frail folks in our communities get the access to the right professionals. So we're going to look at the model, as Dr. Short said, making sure that folks can transition to community. So it will alleviate not just our emergency rooms, but it may also alleviate some pressure in our long-term care facilities as well as people transition back. More access to surgical suites obviously is going to reduce our wait times. More beds allows us to provide care. So it is part of a physical infrastructure of transformation. So we're really excited about the announcement today.
Mr. How many more staff are you going to have to train or recruit to manage these new facilities?
So I think as the waves come forward, as the Premier said earlier, we'll be looking at the staffing models associated with that, and we do know that staffing is going to be a significant part of obviously this transformation. And this is a huge piece around recruitment and retention. It signals not only to our Nova Scotia healthcare workers that we're investing in their workplace, it signals to our youth in Nova Scotia that healthcare is a viable job in this province, and we want our young people to stay and make a life here. It signals to all of the folks who are recruiting across the country and internationally that we're investing in healthcare, and we're going to do what it takes to get it done. So we're really excited about what this looks like, and we will grow our own workforce, but we will also have to bring people in from other places, and this is a huge part of our ability to do that.
You said when the HI project was put on hold, when you announced that, you said market conditions and supply chain, et cetera, were some key issues. How can you guarantee that those won't be an issue? Today you're telling us everything's being done faster. How can you guarantee that?
Well, I'll start, then I'll give Mr. LeBlanc. But I think the fact, this is a key point, so I appreciate the question, is the fact that we're not doing one big, massive facility where at the end you turn on the lights and there you go, right? Basically, it all comes at once, essentially. We're doing it in waves. So the fact that we're doing it in waves will kind of smooth it out, and the markets will change. Hopefully there'll be more labor. We're working hard on immigration, of course, the MOST program for young people in the skilled trades. So we're working on the labor. And I think the market conditions themselves, I mean, we're in a period of record inflation, and that will stabilize stuff. So smoothing it out over time will definitely have an impact on the ability. But Mr. LeBlanc is a little closer to that. But
one of the biggest concerns, and one of the elements I spoke at length over the last number of months, is the issue regarding the labor force impacting the construction industry. It's reality. In the old plan, we were expecting upwards to 1,500 skilled trade workers. Where are they going to stay? How are they going to commute? And the vast majority of those folks were coming out of province, 75%. So that was going to be a significant challenge to overcome. So in our plan, a better plan, it's going to be the construction industry is going to be able to digest and manage that better. When we deliver these projects in waves, if we're talking about drywall folks or electricians or concrete form pours, it's going to be concurrently delivered, from one site to another, rather than waiting 8 to 10 years and expecting we're going to have one, hospital turn on the lights and that's it.
We talk about healthcare for Nova Scotians, but this plan is primarily HRM, correct?
No, so that's an important point because certainly one of the things that we've heard from rural Nova Scotians is their access, just to physically get into the core and stuff like that. So I think what all Nova Scotians should see is more access to the healthcare that they need, definitely, but more physical access to the locations as we kind of move through these waves.
Sorry. I think it's a fair question to ask you for a ballpark estimate of the cost just for the infirmary. The first piece, the new build for the infirmary, we're paying the company that's going to build it a kill fee because of the work they've done on the old plan. So this is a new thing. It's going to look different than the old one. What can you tell people about what the ballpark estimate is for the first part?
It's obviously in the billions. This is significant, for the project. But I want to be clear on the fee today too. Well, what's happening there is we're moving forward. We're buying the work that's been done before, right? This is by no means starting over from scratch. I mean, certainly we're taking the work that's been done. As I've said, we're assessing what we can still work with, what needs to be changed, and then we're moving forward. So there's a lot of work that's been done by a lot of people, including the contractor, and we'll pay for the work that's been done. But
I want to be very clear. This is not a kill fee, right? We're paying the proponent. We're paying PPH, who's been an extraordinary partner along the way. We maintain a great relationship with. We're paying them for their work. All work has a cost, right? So moving forward, there's going to be a lot more to be paid out. $7 million. The $7 million. That's the start, right? I guess in the broader scope, we remain to be in this procurement process. So my answer that it's north of $2 billion that was tossed around a couple years ago, I'd say that's the answer today.
So why is this proceeding as a P3? An Auditor General a couple of years ago said that the province would pay a premium in borrowing costs to go with a P3. Since then, we've seen interest rates go up significantly. Obviously, there's more risk out in the world. Why are you proceeding in this way?
So I guess I can dovetail on my previous answer. We remain to be in the same procurement process that we were before. So the delivery model was a P3. We remain to be in a P3. We've delivered and continue to deliver on the Bears Lake project, the COC there. That's above 75% completion. That project's moving along very well. It's a P3 model. It's showing that it's working in our province. P3 works across the country as well. So we're going to stick with this plan here.
What was the sentiment that you got from healthcare workers when you do your meetings both in hospital and out in the community about the original plan for the HI and the fact that it was dragging on and whether or not it was actually the correct size?
Thank you. The interesting two parts, healthcare workers, clinicians, and so forth, and then members of the public. I think in terms of clinicians, and there are several in the room today, so I'll be interested in the feedback. But what they've told me, and certainly myself and the minister and the deputy, as we've been out and about, is like we don't have time. We need to go. This is really impacting our retention and our recruitment. Facilities are not where they should be, and specifically the VG I'm talking about. And, that's not a surprise and it's not a newsflash. So finding a way to have our clinicians and staff out of the VG faster was a very important goal. So that certainly has been brought home to me loudly and clearly. And then with respect to members of the public, they want access, and so you'll have everything from soup to nuts. Parking, technology. How do I, it's not delivering the care I need when I'm sitting in the emergency room for 9 hours or 10 hours or 13 hours, and so definitely the emergency departments have been high on the list, and was very, very troublesome to me when the plan did not address emergency departments in any way, shape, or form. And so that was a big red flag. So I
guess what I'm getting at is that's nothing new, right? The original plan was released in 2016, 6 years ago, more almost. So When you took on this role, were you hearing from healthcare workers that, look, what is proposed here for the HI is not going to work? The ED needs to be done, and the other stuff we're talking about is not enough.
Yes. Yes.
We're planning the building that Scotia Surgery is in right now. Do you know how much that's going to cost?
No, off the top of my head, we can get that for you.
But that's already known, is it?
Pardon?
Yeah.
That is a known figure at this point. Yeah, please get that. And I'm wondering, has the government hired a public relations firm to help with this? I've heard that was going to happen.
Did we not do a good job today?
No, it's fine. I'm just wondering there's going to be a new website and so on.
The messaging to Nova Scotians on what they can expect for, you're talking about going forward from today? I don't think we have yet. I don't know. There'll be we'll talk to the communications team.
I just want to go back. Like, most of what is announced today is happening in the central zone, but as we all know, like, there's healthcare needs everywhere. Like, I can think of Digby right now, where their emergency department closes very regularly. Can we expect more announcement, more infrastructure coming in the rest of the province following this?
Well, I think there's a major infrastructure investments happening across the province. Of course, in CBRM, people will be aware of that. This is this was a announcement around a specific plan that was already on the table that we're working with today. Investments in healthcare infrastructure around the province will continue for sure. Yes.
And if I can add, we look at capital spending, right? We look at how we develop plans. We have capital plan for roads, we got capital plan for schools, for example. The way that we're pivoting today is demonstrating our agility, how we can be flexible, and how we're going to be looking at moving forward of developing, planning for our healthcare infrastructure needs across our country. What I'd also like to say is that, although today's announcements regarding the HRM, it is the tertiary and quaternary site for the province, where it is the major trauma center for the province, the Halifax Infirmary ER. So this is important for right across the province, right?
Well, just to add to that, though, I think it's important to note that, the parts of our province which are growing are Dartmouth is growing, Bedford-Sackville is growing, and so part of what we're doing here today is responding to population growth. And the second piece, and I want to be, I do want to be careful because I don't want to denigrate anybody, but one of the first things I asked for 15 months ago was our 10-year capital plan for health infrastructure, and that did not exist. And you cannot run a health system without ongoing long-term planning. So what we are doing here today is announcing actions taken and rolling into an ongoing evergreen planning process so that we don't find ourselves in this place again.
Okay, if there are no more questions, we'll wrap it up. Thank you very much, everyone.
Okay. Thanks, everyone.